Hello everyone. This video we are making and spreading to make people aware about the new emerging disease mucormycosis. This disease was initially rarely seen, but now with the second wave of COVID, we are seeing it very commonly.
Mucormycosis is a very invasive and a serious disease. It's caused by fungus. The disease starts in the nose, spreads into paranasal sinuses or sinuses around the nose, and then it goes in the teeth or it goes in the eyes. From the eyes, this disease goes in the brain. Treatment wise, it is necessary to remove that part which is infected by this. That means if the nose is infected, the parts of the nose is inside the parts within the nose have to be excised. If the sinuses are involved, the sinuses has to be removed. If the eyes are involved, the eyes need to be removed. Upper teeth have to be removed, and this happens within 24 to 48 hours. A person who is absolutely fine within 24 hours can be blind with both eyes. If the brain is involved, unfortunately, brain cannot be removed. So once the brain gets involved, death is nearly a certainty. If treated, 70% of the patients can become all right. However, if treated early, then almost 90% of the patients can become all right. Early detection and early treatment is the hallmark of successful outcome. Hence, it is essential that everybody concerned is on a lookout for the disease and pick it up early and treat early. Combination of COVID and diabetes is a lethal combination for this disease. We have seen some cases in wave 1, but the number of cases that we are seeing in wave 2 is unimaginable. All the ENT surgeons, all the ophthalmic surgeons, all the dental surgeons and all the neurosurgeons are busy fighting with this disease.
Just because you have been diagnosed with diabetes and you have been a patient of COVID, particularly the recent second wave coronavirus, there is no need to panic. The early symptoms of mucormycosis is thin blood-stained nasal discharge, blocked nose, either on one side or both sides, swelling over the face, and swelling of the eye associated with pain that is rapidly progressive over a period of hours and not days. Diabetes and the second wave, the variant of the coronavirus, the combination has led to an increasing number of mucormycosis patients. The early symptoms of mucormycosis is thin blood-stained nasal discharge, swelling over the face, swelling over the eye, which rapidly progresses into pain over the head, face and eyes. If treated early, it's almost a guarantee that the patient will not succumb to this fungus. However, a delay of days will unfortunately result in the death of the patient because of the proximity to vital structures like the brain. Pain increases not over a period of days but a period of hours. So the patient might have low-grade pain in the morning, but by afternoon he might have severe pain. This can also be associated with loss of vision in one or both eyes. If you are having one experiences any of the above symptoms, contact your ENT surgeon at the earliest, as there are some hallmark signs which an ENT surgeon will be able to pick up very early on and start the necessary treatment.
Treatment of mucormycosis consists of surgical management and medical management. In surgical management, we need to excise all the affected parts through endoscopic sinus surgery. If eyes are involved, eyes need to be removed. If dentition is involved, we need to remove the dentition. So at the earliest, we should diagnose and we should remove that part. And in medicinal management, the mainstay of treatment is injection amphotericin B. It has two types, lyophilized and liposomal.
The treatment of mucormycosis is injection amphotericin B, the side effects of which are: first, reduction in kidney function, the treatment of which is administration of adequate amount of fluid. Second side effect is electrolyte imbalance, decrease in potassium, the treatment of which is either giving potassium by IV or oral. The third side effect is anemia, for which the treatment is either blood transfusion or by oral route.
Since past one and a half year, we all are in the mental trauma of this pandemic, COVID, lockdown, financial problem, and now in the second wave we are having mucormycosis is one of the major problem. In mucormycosis, we need to treat the patient immediately. We may not do the surgery immediately, but the treatment is very important. We have to do the quick treatment. The liposomal is the best treatment for the patient, but for the patient who are financially poor, for them lyophilized is a treatment available at a cheaper cost. And we are also talking with the company to reduce the cost of this liposomal injection. For this treatment, we have a team of doctors. We have senior ENT doctor Shabbir Indarwala, Dr. Abuzar Indarwala, Dr. Gauri Mahajan, and we have physician Dr. Devre, ophthalmologist Dr. Manish Papai, nephrologist Dr. Kelkar, and neurosurgeon we have Anuj Nete. And last but not the least, nursing team is also available with us.
So my dear friends, if you have diabetes, that cannot be changed, but try to see that you do not catch COVID. To avoid catching COVID, it is necessary that you will put on mask. It is essential that you will keep social distancing, have regular exercises, have good nutritious food, and if possible, if you fall into that age group at this moment of time, get yourself vaccinated.